Today on Santa Barbara Chiropractic News with Paul Zemella.
Chiropractic services is a very broad primary contact healthcare profession with an assortment of different technique and philosophical groups. A distinction has been made. There are those who are called modern multimodal chiropractors and those who are called classical chiropractors. Hoskin have said that MMM, or the multimodal chiropractic management, incorporates components of passive and active care to address both the acute inflammation or pain phase and the chronic or rehabilitation or injury prevention phase. Management often begins with acute injuries and continues through the subacute or chronic phase, with management changing along the path of patient recovery. After the pain and function is normalized, many chiropractors and their patients choose to pursue preventive strategies, sometimes referred to as wellness or performance-based treatment. Not all practitioners pursue this approach. Such multimodal management typically incorporates a combined approach of various manual therapy procedures with an emphasis on high-velocity, low-amplitude manipulation, soft tissue and stretching techniques, rehabilitation and therapeutic exercises, and non-local biomechanical improvement to improve kinematic and kinetic chain function. Other modalities used to include taping, physical therapies, electrotherapeutics, acupuncture, gait, retraining, nutrition, along with cross-training programs. With spine-based management, psychosocial and other risk factors for chronicity are typically assessed at 4 to 6 weeks to avoid progression to chronic debilitation, and similar approaches are important in the prevention of chronic extremity injury. It should be noted that the multimodal approach is a characteristic of a preferred sports chiropractor and is provided to all candidates in undergraduate university education and training. The multimodal approach should be evidence-based where data is available to inform the management. Alternatively, classical chiropractic services do not generally provide the multimodal treatment strategy incorporating soft tissue approaches, physical therapies, active rehabilitation, therapeutic exercises, or pharmacological recommendation. These practitioners follow historically derived approaches. Patient management being typically unimodal in nature. They characteristically utilize a manipulation-only approach and often a spine-only approach to address the patient complaints. However, athletes typically need direct, active, and/or passive management strategies to all tissues, osseous muscles. Muscles, ligament and fascia at the spine, and extremity level in a patient-centered approach rather than a practitioner-centered approach.
For more information about chiropractic care, do call Dr. Paul Zemella at phone numbers 805-687-6629 or fax them at 805-687-0675. Or do visit them at their website, that's www.zemellachiro.com, and get 20% discount on your first therapeutic massage.